Good afternoon, everyone. I'm Catalina Grija, and I'm here with my guest on this podcast, Dr. Farah Sultan, who is also in functional medicine, just like me. And on this podcast, we bring you inspiring stories of physicians that transition to functional medicine for different reasons. But everybody has a story, but the common denominator is definitely a passion to help people be healthy, go deep down to the root causes of problems and make it possible again. Today, I saw a patient who has diabetes, and I asked her, has your doctor told you that you can cure diabetes? Because she has type 2 diabetes. I said, no, just give me a prescription. That's why we're here. So without any further ado, let me introduce to you Dr. Farah Sultan. Welcome, welcome. Thank you so much for taking the time to being on this podcast.
Thank you so much, Catalina, for having me here. It's a pleasure and totally am with you when it comes to being passionate about helping people regain their health back and reverse chronic diseases like diabetes, really using the root cause and lifestyle-based approach.
Absolutely. Love that. Love that. So you're practicing in Alabama, right?
That's
In
correct.
Birmingham, and you have your own center, which is
Vitology Wellness Center. I founded it 11 years ago. And really, it sprung from my own struggles, even as a medical doctor. I had some of my own health issues for which I wasn't able to find answers using the traditional training that I had received in allopathic school. And that's really what steered me in this other new direction of functional medicine. And really, there's been no looking back since then.
super. Absolutely. Everybody, I think, has a struggle, a problem at some point, and I love to find out what was your how did you decide actually to go into functional medicine? What is the story behind that? Would love to know.
Absolutely. And I would love to share because really it's so many women who suffer this way, who needn't suffer this way. So when I was pregnant with my first baby, I was in residency in my last year of residency in Houston, Texas. And I went through an emergency C-section because my doctor broke my waters too soon when I went into labor. She wanted to speed up the process of labor. But what ensued was literally the labor from hell. It was a nightmare unraveling in front of my eyes. And things I had just read about in textbooks were happening to me, where my heart rate, my blood pressure, my amniotic fluid, everything was really tanking. I had to get an amnio infusion where they put fluids into the uterus because it has really lost all the fluid and it's dangerous for the baby. And it was really the scariest moment of my life because I wasn't a doctor anymore. I was the patient. The roles were reversed, and nothing in even my years of training in med school and residency had prepared me for this moment. And it was pretty scary. And then when I brought home my baby, because he was in the hospital in NICU intensive care unit for several days, then I found my body was failing me. It was just not functioning right. My hair was falling. I was tired. I had postpartum blues. I couldn't sleep and was gaining weight instead of losing the pregnancy weight, and really had this upset tummy with intense pain every day. And really, my health was taking a nosedive. And I went to my doctor at my checkup, and she just blew things off. And she said, "Oh, honey, there's nothing wrong. Just get used to motherhood. This is the way it's going to be." And of course, that was a shocker. That wasn't the answer I was looking for. And really, that's what led me to this journey. I wanted to find answers, and I felt like, how can I help my own patients who have very similar symptoms they're coming to me with, if I can figure this out for myself? And that's really what led me to find functional medicine when I attended my first functional medicine conference. And it was such an eye opener because none of these things had been taught to me in med school, as you know. And that's what set me on this journey, which not only really transformed my life, but with those tools that I was able to learn, because we had to go back and get further training, because in medical school, they didn't teach you much about, yes, the pathology, physiology that I had learned helped me, but this was a whole new field that had opened up. And it really has been such a lifesaver, not just for me, but for those who I love to help.
Wow, wow. That is a powerful story. Powerful story. Oh my. And I think when you see the patients now, you can relate and they can relate to you so much better because you went through that. And this is why you're helping them avoid all that pain, as opposed to, you do this because I'm the doctor, right? It's
Exactly.
a totally different. And I think patients that come to us in functional medicine have a totally different attitude because
Yes.
they're already so much more invested, right, in themselves, in their health. Don't you find that true?
Absolutely. And really, it was through this journey that I found out things like I had Hashimoto's and I had IBS, I had food sensitivities, I had hidden gut infections. And really, I was able to dive deep and delve into my labs deeper. And that is why it's such a revelation, really, that you can get to the root cause. You can find out what is exactly wrong and you can reverse this. So I'm so happy to say now that I no longer have Hashimoto's, and I was able to reverse it really by using all of these principles.
Wow, that is wonderful. Wonderful. And there's so many people with so many chronic illnesses that are told, oh, the only solution is a medication for the rest of your life.
Mhm.
The best thing we can do is control the problem, but nobody's talking about cure. Nobody's talking about lifelong solutions.
Mhm.
Everybody's just, okay, no, supplements are not FDA approved. They're not safe. These tests, what's all that about? Nobody, it's unbelievable to me how other physicians don't accept the truth.
Yes. And some of these medications, including over-the-counter medications, can have serious side effects.
Absolutely, absolutely. It's amazing. It's crazy. But all we can do is share and spread the word and hopefully open the eyes and hearts of as many as possible of our colleagues so that they can also help more people become healthy
Mhm.
because it it doesn't make sense, right? If medicine has progressed so much in the last decades, how come more people are sick and the
Mhm.
diseases occur at a younger age and more certain type of diseases, definitely metabolic and cancer and mental? It does not make any sense if it's all about medicine, but it's not, right?
Exactly. And that's why it is so important to even be aware that it is a possibility. And even the labs that you do, normally when you go to see your primary care physician, yes, they are going to run labs, but they are very quintessential labs. They are not in depth and they can only give you so much information. So unless you know your data, how can you help yourself? And that's what I love about this approach, is that you can really dive into that personalized approach and look at data, understand what's going on, what's wrong, and not even, yes, we do use supplements, but they are based on targeted issues that are based on your labs and levels. And it doesn't mean you have to take them for the rest of your life. Once the need is met and the goal is really to get it from real foods, but sometimes that may not be adequate because we just have soils that are depleted and foods that are depleted as well.
Right, absolutely. And I think people don't see how poor the quality of the food is. And if you're adding the chemicals to it and the toxins, it's all this processing, it's impossible to have a healthy nutrition. Yeah. So it's definitely paramount to find out exactly what works and what doesn't work and how we can improve. But awareness is the first thing, right? If you're not aware of how your body works, it's not possible to address the issues. Wonderful. So if you were to think back, would you have done anything different, or what advice would you have given to yourself, like, maybe not 11 years ago, but maybe 20 years ago, if you knew what you knew now, if you knew what you know now?
Yeah, so absolutely. I would have focused more on knowing what I'm putting into my mouth in terms of the foods, because I wasn't reading the labels like I do now. I wasn't finding out the source of the meats and fruits and vegetables and how they were grown and how they got to my plate. So that's something I wish I knew before. And also to question any sort of medication and procedure, that is this really necessary, or what are the side effects, or can this be a particular symptom? What's the root cause, and what can I do to reverse it, first through lifestyle, and what specifically in food, lifestyle, supplements I could do before reaching out, even for allergies or even for fever or simple things, that there are other better alternatives.
Right, absolutely. And it's so much important. So it's so important because we can pass this knowledge to our children. And I think we give them life, but if we can give them the awareness and the understanding of how to be able to design a life, not just to leave it up to chance and go with the flow, peer pressure, right? That's, I think, the best success that we can have in life. But what's your definition of success, in functional medicine?
Really, health is everything. And if you don't have your own health, then there's so many things that limit you, right? Like they say that a man who has health has many wishes, a man who does not has only one. And so
Yes.
that just is so true. And don't get me wrong, I do believe that as a physician, we can have the best of both the worlds, because yes, there is a role of medication to be played, and we see very, very sick people who can be really helped. However, to have this sort of a happy marriage between the functional as well as traditional medicine, I think is really such a gift to have, to really be able to help people to really get and feel better, because then the doors open for them to be able to enjoy life and be there for their loved ones and advance in their careers. And so I see so many people retire, but only to be sick and going to the hospital for procedures and for doctor's visits. But there's so much to look forward to when we have our health.
Absolutely, absolutely. I heard this abbreviation like MAP actually means make a plan, can stand for make a plan, right? And I don't think that anybody makes a plan with people in their maybe 50s or 60s. How do you wish to look and feel and be at 70 or at 80? If you're waiting for things to just deteriorate, what good is that? Why don't we address that issue to make sure that we help people stay healthy and in good strength and vibrant health so
Mhm.
that they enjoy retirement?
Exactly. That's and look forward to enjoying life with their kids, their grandkids, and nephews, nieces, great grand nieces. And why not? Why not travel the world or take up a new hobby and do things you've never done before? And that's why I'm passionate about longevity and love to help women balance their hormones and sleep, because all those are essential sort of pillars that we have to address in order to live longer, healthier lives.
Right, absolutely. So what is your niche? So what do patients know you best for?
Really to help them balance their hormones using the mandala approach, which uses these pillars of health that are all interconnected, which is nutrition, gut and immune and liver support, microbiome support, the hormone balancing, the mind body balance, and a lot of that is stress management and sleep, and then the fitness and movement and activities. And it doesn't mean working out for hours in the gym. And then the central piece is the education piece, connecting it together. So it makes sense, because instead of just telling people to follow some sort of a protocol or diet, those things just don't work. But if you have a better understanding of your body and how it works and what your labs mean, you really become independent with your health. And that's the whole goal.
Yes, and I think that people, once they understand why you're asking them to do something, to eat some a certain way, they're much more likely to follow through. And because they understand why, it's not just, oh, because I say so, or because
Exactly.
it's generally accepted as, healthy.
Mm-hmm.
So it's functional medicine, it's personalized medicine,
Mm-hmm.
basically.
Yes. And it is evidence-based, because it is not just based on, kind of, yes, there is an art, but it's not just that. It is backed by science and evidence-based, which, again, when I was an internist, and in my regular busy practice, I didn't have time to read these articles, which now I love diving deeper into.
Right. And I think that a lot of us, and especially women doctors, right, in traditional medicine, we tend to burn out because we're
Mhm.
trying to do everything and we're trying to give so much and we feel so guilty that we try to give even more and we end up really not showing any love for ourselves.
Yes.
And I think this transformation, this approach, functional medicine approach, starts with really loving ourselves, addressing ourselves, because just like on the airplane, right? They say put the oxygen mask on you first and then on your child or your loved one. It's not possible to give if you don't receive anything. It's not possible, right? So
Exactly.
it's so much more about balance, right?
Yes. And
Balance.
yes,
Mhm.
we have to learn that ourselves as women physicians, but also impart it to a lot of our patients are women. And
Mhm.
so to help them understand the importance of self-care and self-love.
Absolutely. Absolutely. What's a popular, like, maybe health hack or wellness thing that makes you like, ooh, cringe, like cringe? It's like, no, 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 don't do that.
Um, I mean, some of the health hacks that I probably have been hesitant to do are maybe coffee enemas, but read some good stuff about it helping your glutathione levels. So I haven't really dived deeper into that myself, but because I always like to experiment on myself. But again, I had this stigma against cryo and cold therapy, but actually now I do it myself, and it's not bad. But in terms of cringing from it, I can't really think of anything top of mind.
Okay. Okay. Super. Um, has this changed your family in
Yes.
any way?
Absolutely, yes. Because I have 3 kids, and they were picky eaters as when they were little. Luckily, they're older now. But I think it has helped them to adopt a healthier lifestyle. My husband as well. They are sometimes a little skeptical and make fun of the things I say and do, but sometimes they do when they themselves notice they feel better, then they come around to it, because it's hard to get teenagers to eat healthy, especially with peer pressure. But we call digestive enzymes the cheat pill in our house. So they're like, "Mom, I have the cheat pill." Because I had too much gluten or dairy or something like that to eat.
Yes, yes, yeah, it's true. I think for some people they would say that it's hard to live with a physician in the house, right?
Yes, yes,
Especially for
yeah.
yeah,
And
especially women physicians, right?
of course. And they're like, "Mom, does this also cause cancer?" So, yeah.
Yeah,
Use
yeah. Wow.
sunscreen. I tell them, don't use that toxic sunscreen, use the zinc base. But yeah, it doesn't, spread as easy and things like that.
Right. Yeah. The first thing I did when I learned about functional medicine, I did the nutrigenetics for my kids. I said, I gave them life. Now let me tell them how to live their lives. And I think that was an eye opener because they had, several issues there. And I think, wow, really? And like many others, right? They have these aha moments. Oh, that's why I was feeling like this when I was eating that. And that's
Yes.
why it's like, yes. So that feeling is not the worst thing that can happen, but certain things can really go wrong if you don't pay attention and
Hmm.
change your environment.
Yes.
Because we're given these tools that are priceless.
Yes, yes. And even things like the stuff you use to clean your home, or all the fragrances and the skincare and all that. So yes, I think they realize now that it does make a difference, and they're more on board, and which will help their kids when it's their turn.
Absolutely, absolutely, absolutely. Um, do you have anything, like a go-to guilty pleasure, that functional medicine would kind of not consider kosher or like would frown upon? Do you have any of those?
Um, Let's see. So I love to travel, and of course, I love to try new foods, especially all over the world. And so sometimes, for example, we were in Rome and we went to the bagatto, and we had the fried artichokes, I remember. And of course, I had to have it. And normally, I'm very, very sensitive to. I do have a problem with gluten even when I travel out. So I had to take lots of digestive enzymes, but it was worth it. But yeah, that is something you have to have sometimes. You can't avoid it. And traditional dishes like that, for example, again in Italy, I had the Parma cheese, which was aged for 3 years with they make the balsamic, which is aged, and it was to die for. I mean, it tasted like syrup. It was just aged, but it was so good with that aged Parmesan. But it was made by this lady in her house. So we went to a cooking class there, and yes, so I had to have it, but it was I was totally fine. And they say that food in the US is more likely to be more reactive, even if you ate the same category sometimes in other countries.
Yes, yes. There are so many things that are banned. There's so many chemicals that are banned in Europe and elsewhere, but not here,
Mhm.
unfortunately. And let's hope that this happens here too. I don't want to see atrazine on any toxic panels for anyone anymore
Exactly.
because,
Which
mm-mm,
is sad, and that's why we are a very sick nation compared to other developed countries.
absolutely. And we use the highest percent of GDP for healthcare.
Exactly,
We
sick care.
sick care, right? It's not, yeah, you cannot even call it healthcare. It's sick care, like Mark Hyman says, right? Yeah, absolutely. So, um, if you were to, like ask other physicians, or if you ever talk to them, why do you think there's so many physicians that, and among our friends, definitely among my friends, why
Mhm.
are so many that are oblivious to the benefits of functional medicine and they refuse to even take a look? Why do you think that is?
Um, One could be just lack of education because we don't really know much about it. So sometimes it's ignorance, but at other times it may be because there's a conflict of interest because, you know, they were, for example, an oncologist is going to believe in prescribing or promoting chemotherapy. And, and that's kind of their area of expertise. So maybe it's hard for them to see another point of view or step outside the box in terms of what they've been taught. But also, we are a very litigious society. So if the standard of care isn't followed, then there may be consequences of getting sued and things of that nature. So there may be fear driving that as well, and acceptance because they feel that this is something which is not globally acceptable. And that's why maybe they are not willing to kind of uh, go out on a line and say or believe and do things. But again, not everyone is like that because I've had some colleagues start even referring patients to me because now they see that things that they were not able to help certain patients with, or who would take too much of their time to talk to them about changing their lifestyle, or they may have assumed that this patient is not going to change their lifestyle and be resistant to it. But when they did see those changes, they sort of changed their mind maybe a little bit in terms of saying, okay, maybe just as an example, it's someone with fibromyalgia and they deal with chronic pain, chronic depression, chronic insomnia, and many physicians don't want to deal with such patients because they may even label them as train wrecks. And so if someone is willing to spend the time and talk to them and work with them and really help them, then maybe uh, it's almost like they're like, okay, you can take care of this patient. I don't have the time to. So, or rheumatologists have to deal with that. And gastroenterologists, like I have a gastroenterologist friend who said, oh, but they're not going to change their diet. So what's the point? And so it's easier to just give them a pill. And so to kind of work with them that yes, it can happen. It won't happen overnight. It takes time. You have to work with them. But yes, you can really and truly help them. On the other hand, and even cardiologists, like sometimes they'll turn, the other way and say, okay, just keep doing what you're doing. Instead of asking them, what was it that you did that made this change? So yes, I guess you see a mix of all kinds of personalities and people and how accepting and willing they are to look at things with a different perspective.
Yeah, yeah, absolutely. Um, and I think that it's a blessing actually that in functional medicine we have more time.
Mhm.
We
Yes.
have the time with patients, and I think they appreciate that so much. and we're not allowing, third party to assess the value of our time and the severity of their problems and put a label on it, put a cost on that, a price on that. No, this
Yeah.
is how much I need for this person. This is how much I'm going to spend with them. That's how much time I'm going to spend. So,
Yes. Yes, that can be a very limiting factor when you're in a busy practice and you're
yeah,
really dictated by insurance to see so many people. And that's what leads to burnout, because you truly in your heart went into medicine to help people, but when you're rushing through, it's stressful because you're really not able to talk and understand what's really truly bothering them and help them out.
absolutely. Yeah, I was employed for 1 year or one a year and a half or so right after residency. After that, I went private because I could not follow this 15-20 minute rule. That's not me. I can't. So I had to just follow my schedule, and it came
Mhm.
with absolutely big time burnout
Yes,
because you're it's a lot of work, but I don't regret it, absolutely. But I wish I knew about I wish I knew about functional medicine sooner. That's for
absolutely.
sure.
Yes. And that even, so to your earlier question about doctors, one group of doctors that I have had issues with acceptance is OBGYNs. And again, not all of them,
Mhm,
but
mhm.
they've literally made women cry because they asked them about hormones and they literally were not open to even them taking hormones from a different doctor, that they just instill this fear in them that they're going to develop cancer and heart disease, and it's so not true. And so and then even to have that conversation, okay, let's assess your risk, let's see, look at the studies, let's answer your questions, let's check your levels, none of that, and to be so dismissive. So that's been disheartening for patients and someone who is passionate about helping women, especially balance their hormones. And now that they have options, why not offer it to them?
Yes, yes, yes. Oh my, yeah, absolutely, absolutely. So, if you were to write a letter to yourself 10 years from now, how would you describe your life 10 years from now?
Um, Definitely feeling my healthiest, best self, being physically active, pursuing my hobbies, and one big one is traveling, and to have more time, really freedom of time, freedom of geographically to be able to be anywhere, and the world is such a small place, and really to have helped people, get healthier and better and well. And that really is the legacy that I would like to be known by and have achieved, is by how I've made a difference in other people's lives to lead healthier, better lives.
Beautiful, beautiful. Yeah, absolutely. And again, if you were in traditional medicine, I don't think you would have the same,
Mm-hmm.
the same, you wouldn't think that this would be possible
Right.
10 years from now.
Yes.
So it's so beautiful. It's amazing. So I hope we all enjoy, life from now on and make an impact. My goal, my vision is to impact 1 million people's lives. So that if I can get there, I think I've done my part.
That, and
And
you can do it. You can absolutely do it.
you can do it, right? Because you don't have to be limited to the people that just walk through your door.
Mm-hmm.
Now it's so much more open to so many other people, even in the same state. But there's so many people in each state, right? And I think we can make a big difference. Absolutely. And yeah. So it's definitely a legacy to live by. And who knows? I see that around my colleagues, not a lot of the children of physicians actually become doctors or want to go to medical school. But with more physicians in functional medicine, more children of functional medicine physicians would develop a heart for functional medicine and keep the the tradition in the family going.
Absolutely. And I can say that at least among my staff and team, I have some young women that I have inspired to go into functional medicine.
Super wonderful. It was amazing to have you here. And for our listeners that want to reach out to you, we're gonna put the website here. But the website is
vitalogywellness.com. That's VITALOGY wellness at .com.
.com. Okay, perfect. Birmingham, Alabama, Dr. Farah Sultan. Thank you so much. It's been a pleasure. And we'll look forward to having you as our guest on another podcast.
Thank you so much. And thank you for having me. The pleasure is all mine.
Thank you.
Thank you.